Hello and welcome. Today I'll be speaking to you about the topic called Dupuytren's or Dupuytren's contracture. So what essentially is Dupuytren's disease or Dupuytren's contracture? Now just picture for a moment on the palm, there is a structure there referred to as the palmar fascia or the palmar aponeurosis. If for some reason this palmar aponeurosis becomes thickened, shortened, it will definitely have some impact on the fingers. So what happens is that in this condition, there's fibroblast proliferation, excessive deposition of collagen in that tissue called the palmar fascia. When that occurs, it becomes thickened, shortens, and then pulls on these fingers, particularly the fifth digit and the fourth digit. These two digits are most likely affected in Dupuytren's contracture. When that happens, you find a situation where the patient's hand appears somewhat in this manner. And so what we refer to this as is some flexion contractures. Contracture simply means that tissues such as muscles, ligaments, tendons, when they come to the point where they shorten and tighten up, they produce a structure like this, a form of deformity referred to as contractures. So Dupuytren's contracture simply means thickening of the palmar aponeurosis and progressively resulting in a deformity that produces a contracture. Why does this occur? There could be genetic components, and so you find a situation where these patients are most likely to be whites of Northern European descent. It's been reported in Tanzania and Zimbabwe, but in fairness, I can't recall a time where I've diagnosed this condition in a Nigerian. I'm not in any way suggesting that it doesn't occur in Nigerians, but I really cannot recall at any point in time. So it most likely is a very rare condition or unlikely to occur in a Nigerian or less likely to occur in Africans. It's also quite uncommon among Indians, and also the incidence increases with age. Many patients tend to be over 50 years of age. It also more likely occurs in males, and when it does so, it's more likely to have a greater severity than when it occurs in a female. There's also some association with manual labor with vibration exposure. So for patients that work with those equipments that cause a lot of vibration, there is an association. Patients that have had prior hand trauma, also alcoholism, smoking, diabetes mellitus, and hyperlipidemia, which simply means raised level of cholesterol. When patients present, they usually, for those that have the advanced condition, there will be some decreased range of motion, producing what is called a contracture. You could also sometimes see and feel for the nodule or the cord in the palm, and therefore because of that contracture there'll be less or loss of dexterity in the usage of the hand. The progression of disease usually would be from initial nodule, formation of cords, and then development of a contracture. What are the outcomes? For some patients, it stabilizes, doesn't progress, it just remains as it has been. For some others, it could actually regress, and for some also, there could be progression of disease. And so what's the treatment modality for these patients? It depends, of course, on the outcome. For those that have no or minimal contracture, no functional impairment, the nodule is painless, you could just simply observe. For some others, it may be required for them to go for physical and occupational therapy. They may require steroid injection. There may be a place for collagenase injection. There may be a room for radiotherapy, and some patients may actually require referral to the surgeon for a procedure. The surgeons in this case will be either an orthopedic hand surgeon or a plastic surgeon. So this condition is called Dupuytren's contracture, presenting with thickening of the palmar aponeurosis and may result in contractures down the line. Thank you. Please share, like, and subscribe. See you again.